If you are a woman who has journeyed beyond the age of 60, there is a conversation that we urgently need to have. It is a dialogue that is at once private, profoundly important, and quite possibly life-saving. This conversation revolves around a subject that few of us in our culture ever feel comfortable discussing openly: the act of self-pleasure. You have likely been told throughout your life that masturbation is a harmless, perhaps even a beneficial practice, and in many respects that is absolutely true. But here is a critical piece of information that very few people, and especially older women, are ever told. As your body undergoes its natural and expected changes with age, so too do the risks that are associated with this deeply personal and intimate act. And under a specific set of physiological conditions, an act that is intended to bring you comfort, relaxation, and connection could, in fact, place your health at a serious and significant risk. My name is Dr. Lily Stones. For more than 3 decades, I have had the immense privilege of working closely with women just like you, strong, wise, and deeply caring women who possess a powerful desire to live their lives fully, joyfully, and, most importantly, safely, in every single season of their existence. And I am here today to shine a bright and unwavering light on the 7 most medically risky and vulnerable times for women over the age of 60 to engage in the act of self-pleasure. These are specific moments and scenarios when your heart, your blood pressure, or your emotional health may be far more vulnerable than you could possibly realize. This message is not intended to evoke feelings of shame or to instill fear. Rather, its sole purpose is to equip you with the essential knowledge that you need to stay safe and to feel genuinely empowered in your own body. Because it is my firm and unwavering belief that when you truly understand the intricate workings of your body, you can then care for it with the highest degree of confidence and compassion. If you have ever found yourself wondering whether timing truly matters when it comes to matters of intimacy, then this might be the most important and impactful information that you will hear all year. So, before we begin our deep dive into this crucial topic, please take a moment to like this video, to subscribe to our channel, or to share it with a dear friend who deserves to feel supported, informed, and truly seen. Now, let us begin our exploration with one of the most surprisingly dangerous times of the day, a time that a great many people mistakenly believe is the very safest. 1. Between 400 a.m. and 6,000 a.m. The cardiovascular peril of the morning surge. You might naturally think that the profound quiet and stillness of the early morning hours would make it an ideal and peaceful time for private reflection or for intimate connection with yourself. But from a purely medical and physiological perspective, this window of time represents one of the riskiest moments of the entire day, and this is especially true for the health and well-being of your heart. During these pre-dawn hours, your body undergoes a remarkable and completely natural phenomenon that cardiologists refer to as the morning surge. As your body begins its gradual transition from a state of deep sleep to one of wakefulness, your blood pressure and your heart rate both rise with a notable and sharp intensity. This is a normal and necessary part of your body's intricate preparation to face the demands of the day. But it also creates a temporary and significant period of heightened cardiovascular vulnerability. Now, let us add to that already strained physiological state the additional physical stimulation and the complex hormonal response that are triggered by the act of self-pleasure, a further increase in your heart rate, the release of powerful hormones like adrenaline and dopamine, and temporary but significant spikes in your blood pressure. When you combine these two factors, the overall risk to your cardiovascular system escalates dramatically. According to a large body of research that has been published by the American Heart Association, the majority of heart attacks and other acute cardiac events occur in the morning, and this is often due to this very surge in blood pressure, combined with other potential stressors that are placed upon the heart. For women over the age of 60, whose blood vessels may have naturally become less elastic and whose cardiovascular systems may already be under some degree of strain, this early morning window is particularly and acutely risky. I want you to think of it like starting the engine of your car on a frigid winter morning and then immediately slamming your foot down on the accelerator. Your body's internal systems are simply not ready for that level of intense demand yet, and forcing such activity too soon can potentially lead to serious and life-threatening consequences, including dangerous heart rhythm disturbances or even, in the most severe cases, cardiac arrest. That is precisely why I always advise my patients to wait until at least mid-morning, when your body has had an adequate chance to regulate its internal rhythms and to stabilize its cardiovascular function, before you engage in any kind of physically intense activity. Please give your magnificent heart the time it needs to wake up gently, right alongside you too. Right after taking blood pressure medication, the treacherous double drop effect. If you are one of the many older adults who takes medications to manage high blood pressure, there is something of critical importance that you need to know about the timing of these medications and your personal activities. Most anti-hypertensive medications are designed to reach their peak level of effectiveness within 1 to 2 hours after they have been ingested. During that specific window of time, your blood pressure may drop to a level that is lower than your usual baseline, which is precisely what the medication is intended to do. However, when you combine that medication-induced drop with the natural physiological effects of sexual arousal, such as vasodilation, the widening of your blood vessels, you create a significant risk for a condition known as orthostatic hypotension. This condition is characterized by a sudden and dramatic drop in your blood pressure that can cause symptoms such as severe dizziness, fainting, syncope, or a dangerous and potentially injurious fall. I want you to imagine the feeling of standing up too quickly and feeling momentarily woozy or lightheaded. But now, imagine that very sensation being compounded by the significant cardiovascular effects of a climax. In that critical moment, your brain may not be receiving an adequate supply of oxygen, which can lead to a state of disorientation or even a complete collapse. And because the act of self-pleasure is typically performed in private, any fall or blackout that occurs could go completely unnoticed for a period of time, thereby delaying the urgent medical help that might be required. The Mayo Clinic strongly emphasizes the importance of managing these timing issues with great care and attention. A simple and highly effective guideline is to wait for a period of at least 2 hours after you have taken your blood pressure medications before you engage in any activity that is likely to elevate your heart rate. Your safety is not about avoidance, it is about intelligent and informed timing. By creating a space between your medication and your personal time, you allow your body the necessary window to adjust and thereby significantly reduce the risk of experiencing these dangerous drops in blood pressure. 3. Immediately after a hot shower or bath, the temperature shock trap. There is something undeniably and deeply soothing about a hot bath or a steamy shower, especially for our sore muscles and our tired minds. It is a ritual of comfort and relaxation for many. But in the moments immediately following your exit from that warm water, your body is in a surprisingly vulnerable physiological state. The heat from the water causes the blood vessels throughout your body, particularly those near the surface of your skin, to widen significantly. This process, which lowers your overall blood pressure, also serves to redistribute a large volume of your blood away from your core and your brain and out toward your skin. This is a fundamental part of how your body works to cool itself down. But during that specific period of thermal regulation, your entire circulatory system is already working overtime. If you then add the additional demands of sexual stimulation to this already strained system, you can potentially overload your cardiovascular system. Some women have described feeling intensely lightheaded or even faint after combining a hot bath with intimate activity. Others have reported experiencing heart palpitations or irregular heart rhythms, which are clear signs that the body is struggling to balance the demands of temperature regulation and cardiovascular exertion at the exact same time. This phenomenon is sometimes referred to as temperature shock, and in older adults, it can be a very serious matter. A comprehensive study published in the Journal of the American Geriatric Society noted that post-bath fainting is a significant and often overlooked fall risk for seniors. And this is especially true when it is combined with any form of physical exertion. To substantially reduce this danger, it is imperative that you give your body a chance to return to its normal baseline temperature and circulatory state. Please wait for a period of 30 to 45 minutes after bathing before you engage in any activity that is likely to raise your heart rate. And always be mindful of your surroundings. Bathrooms can be slippery environments, and a sudden fall in such a space could easily lead to broken bones or even worse outcomes. 4. Late at night, 1100 p.m., 200 a.m. Cognitive slowdown and loss of balance. A great many older adults find that the late night hours are their most private and uninterrupted moments. The house is quiet, and the distractions of the day have finally faded away. But from a medical standpoint, this is a time when both your mind and your body are naturally winding down, and this can present a series of risks that you might not expect. Between the hours of approximately 11 p.m. and 2 a.m., your brain's cognitive performance is at its lowest point in its 24-hour cycle. Your reaction time slows down, your physical coordination declines, and your sense of balance becomes demonstrably more unstable. According to the National Sleep Foundation, seniors are particularly vulnerable to late-night disorientation, and this vulnerability is significantly amplified when it is combined with any form of physical exertion. Following a climax, your blood pressure naturally dips, and a flood of relaxation hormones enters your system. This is a normal and healthy physiological response. However, when this occurs within the context of late-night mental fog and in low lighting conditions, it significantly increases the risk of falls, particularly when you are walking to the bathroom or simply repositioning yourself in bed. What is more, our emotional sensitivity also tends to heighten during these late hours. Feelings of loneliness, sadness, or grief may become more pronounced, which can change the nature of self-pleasure, making it more about coping with difficult emotions than about genuine connection with oneself. While that is not inherently harmful, it is certainly worth paying close attention to the emotional context of your choices during this time. Instead, I would suggest that you try to engage in moments of intimacy earlier in the evening, when your mind is clearer, your balance is steadier, and your emotional state is more stable and grounded. 5. When dehydrated, especially before breakfast, the hidden risk of collapse. Your body relies fundamentally on proper hydration to function safely and effectively, and this is especially true when it comes to the health of your circulation and your brain. But here is the stark truth: the majority of adults over the age of 60 wake up in the morning in a state of mild dehydration. After 7 or 8 hours without any fluid intake, your blood naturally becomes thicker and more viscous, your circulation slows down, and your blood pressure may consequently dip. If you then add the significant cardiovascular demands of masturbation to this already compromised system, such as an increased heart rate, dilated blood vessels, and a surge of hormones, the result can be a dangerous and sudden drop in your blood pressure, a condition known as orthostatic hypotension. This condition, which causes severe dizziness or fainting upon standing or changing positions, is especially common in older adults. According to the National Institute on Aging, it is one of the leading and most preventable causes of falls among seniors. I want you to picture this scenario. You begin your morning feeling perfectly fine. You decide to engage in a private moment before you have had your breakfast, and then suddenly, you feel overwhelmingly weak, dizzy, or disoriented. In that extremely vulnerable state, while you are alone, and possibly standing or walking, you are at a very high risk of falling, of hitting your head, or even of losing consciousness, all without anyone nearby to provide assistance. The solution to this particular risk is both incredibly simple and profoundly powerful. Drink a full glass of water first thing in the morning, ideally 15 to 30 minutes before you engage in any kind of physical activity. This simple act helps to thin your blood, to improve your circulation, and to ensure that your brain is receiving the adequate supply of oxygen it needs to keep you steady, alert, and safe. Something as small as keeping a water bottle at your bedside can offer you an invaluable extra layer of protection, one that could quietly and unassumingly save your life. 6. After long periods of sitting or lying down late, circulatory risks, and blood pooling. Whether you have been engrossed in a book, watching television, or simply taking a nap, long periods of physical stillness cause the blood in your body to settle and to pool in your lower extremities. This phenomenon, known as venous stasis, is especially true for older adults whose circulatory systems are not as responsive and efficient as they once were. Now, I want you to imagine moving directly from a prolonged period of such inactivity into an act that demands an increased heart rate, a greater supply of oxygen, and a significant degree of muscle coordination. Your cardiovascular system might not be prepared for such a sudden and demanding shift. The potential result is a drop in blood pressure, a feeling of dizziness, or a general sense of being unstable. Some women describe it as a head rush or a feeling of lightheadedness, but it can be a serious warning sign of significant circulatory strain. What is more, prolonged periods of sitting have been shown to increase your risk of developing blood clots, especially in the deep veins of your legs. According to the CDC, this condition, known as deep vein thrombosis (DVT), is more likely to develop in older adults who are sedentary for long periods. If you then suddenly stimulate your blood flow through intense physical activity, there is a risk that the clot could become dislodged and could cause a very serious and life-threatening complication, such as a pulmonary embolism. To substantially reduce these risks, it is imperative that you ease your way back into motion. Before you engage in any kind of intimate activity, please take a few minutes to stand up, to stretch gently, and to walk around your space. Gently move your arms and your legs to get your circulation flowing again. I want you to think of it as a necessary warm-up, just as you would perform before a light workout. This one simple step can provide you with a powerful layer of protection against these unexpected and potentially severe complications. 7. During emotional vulnerability, loneliness, grief, or stress, the act of self-pleasure is so much more than just a physical act. It is deeply and inextricably connected to your mood, to your memories, and to your fundamental sense of self. And when you are feeling emotionally low, whether it is from a sense of loneliness, from the weight of grief, or from the pressures of stress, it can be very tempting to use the act of masturbation as a way to escape from those difficult and painful feelings. There is absolutely nothing wrong with seeking comfort, but when the act of intimacy becomes a substitute for genuine emotional connection, it can lead to a cycle that is ultimately more numbing than it is nourishing. You might experience a sense of relief for a few moments, but then you may come away from the experience feeling even more alone, more disconnected, or more profoundly fatigued. This pattern is not at all uncommon. In fact, comprehensive studies from the Journal of Sex Research have shown that when people utilize sexual activity primarily as a method for coping with emotional distress, they often experience heightened feelings of depression or isolation afterward. That is because the temporary release of chemicals like dopamine and oxytocin cannot fully and adequately address our deeper and more fundamental emotional needs, such as the need for companionship, for meaningful conversation, or for a sense of belonging. So, what can you do? I suggest that you start by gently checking in with yourself. Before you begin, ask yourself, am I doing this from a place of comfort and joy? Or am I attempting to avoid something that lies deeper within me? If the answer to that question feels heavy, I would encourage you to consider reaching out. Talk to a trusted friend, to a counselor, or consider joining a support group. You are not alone in these feelings, and there is immense strength to be found in acknowledging them. Your emotional health is every bit as important as your physical health. When both are respected and nurtured, self-pleasure becomes a genuine form of care, not a means of escape. A wiser approach to intimacy. Practical guidelines for safety and well-being. Now that we have carefully examined the 7 riskiest times to engage in self-pleasure after the age of 60, it is time to shift our focus. Because intimacy is not something to be avoided, it is something to be approached with wisdom. Growing older does not mean that you have to give up on your private joy or your bodily connection. It simply means that you are invited to become more mindful about how and when you engage. Here are a few simple changes you can make to provide foundational support for your well Being. First, choose the right time of day. The period from mid-morning to early afternoon, generally between 10:00 a.m. and 2:00 p.m., is typically when seniors experience their most stable levels of energy and blood pressure. Second, hydrate first. Always make it a habit to drink a full glass of water 15 to 30 minutes beforehand. This small and simple step can significantly reduce your chances of experiencing dizziness or collapse. Third, move a little. If you have been sitting or lying down for an extended period, perform a gentle warm-up. Stretch, pace slowly around the room, and breathe deeply. You are preparing your body in the same way that an athlete would before an activity. Fourth, check your medication timing. If you are taking any blood pressure or heart medications, please allow at least 2 hours to pass before you engage in any activity that might increase your heart rate. And fifth, create a safe space. Use soft but adequate lighting, avoid any slippery floors, and if your balance is a concern, please remain seated or reclined on a stable and supportive surface. These are not limitations, they are gentle and loving guidelines to help you feel safe and respected within your own body. Because pleasure should not have to come with an associated risk. And it certainly should not come at the cost of your well-being. When you understand what your body truly needs, you are not giving up your freedom. You are gaining a profound sense of confidence. You are actively choosing to make intimacy a part of your life that supports your health, not one that undermines it. In your younger years, you may not have given much thought to the when or the how of self-pleasure. But as you grow older, your body begins to operate on different rhythms. The most important message of all is this: listen to your body. Really and truly listen. If you feel off, slow down. If your heart races in a way that feels different or uncomfortable, pause. If your breathing feels shallow or you feel lightheaded, do not push through it. These are not interruptions, they are loving invitations from your body to treat yourself with the utmost care. You deserve to feel safe. You deserve to feel pleasure. And most importantly, you deserve to feel confident in the way that you care for your body, even in its most intimate and private moments. This chapter of your life is not about limitation, it is about recalibration. It is about choosing awareness over accident, prevention over pain, and empowerment over silence. So, go gently. Be kind to yourself. Know that you are not alone, and that there is immense wisdom to be found in your desire to care for your body, even in its quietest moments. And if this message has resonated with you, I invite you to reflect. What have you learned about your body today? And who in your life might need to hear this message too? Let us keep this conversation going, not from a place of shame, but from a place of strength. Together, we can create a space where aging and intimacy are not treated like opposites, but like partners on the same beautiful journey. I am Dr. Lily Stones, and I am honored to walk alongside you on this path. Be well, be safe, and never stop listening to what your body has to say.